For women who've used marijuana while pregnant, new research shows the potential health risks to their baby. That study has just been released by Kaiser Permanente. It looked at more than 360,000 mothers and infants. And Dr. Lyndsay Avalos is a research scientist at Kaiser. So, doctor, thanks for joining us. First, explain the types of health risks that could be associated with cannabis use during pregnancy.
Yeah, thanks, Ryan. So just to give it a little background also that as to why it's important to understand these is we've seen over the past, recent years, an increase in legalization of cannabis use across the U.S. We've also seen increasing acceptability and accessibility of cannabis. And our team has also noted a trend in increasing cannabis during pregnancy as well. However, the health effects of cannabis during pregnancy is not really well known. And so we wanted to conduct this study to really be able to provide some more evidence for pregnant patients and their clinicians. And so what we found in this study was that maternal prenatal cannabis use was associated with an increased likelihood of small for gestational age babies, low birth weight, preterm birth, and admission to the neonatal intensive care unit.
And the study, I understand, looked at other variables like socioeconomic status. Tell us about those.
Yeah, great question. So a really big strength of our study is that, one, we had a large population that we were able to assess this association in. And so our study included over 330,000 pregnancies during between 2011 and 2020. And of those pregnancies, 6% or over 22,000 pregnancies had maternal prenatal cannabis use. And since we used data from the electronic health records, we were really able to address some other potential variables that could impact this association. And so we were able to account for them, such as maternal demographic characteristics, other non-cannabis substance use, adequacy of prenatal care, and as well as other maternal comorbidities, such as gestational diabetes, hypertension, and mental health comorbidities as well.
Yeah, what about mothers who may be using marijuana for medical purposes? What would you recommend to them?
Right. So our team has conducted research with pregnant patients that to try to understand why they may be using cannabis during pregnancy. And as you said, many of them have responded that they use it to treat conditions during pregnancy, such as nausea and vomiting, depression or anxiety, and that they feel that it might be a healthier alternative since it's natural to pharmaceuticals during pregnancy. However, our study contributes to the growing evidence base that there are adverse health effects of maternal prenatal cannabis use. And so I think when pregnant patients are considering cannabis use, they should also consult with their clinician.
So like even in moderate use, it's probably not safe.
Well, our study, we did look at the frequency of cannabis use. And what we did find was as the frequency of cannabis use increased, so did the as the frequency of cannabis use increased, so did the likelihood of low birth weight children and SGA birth.
All right, well, always good information. So Dr. Lyndsay Avalos with Kaiser, thank you very much for joining us.
Thank you, Ryan.